I'm a general physician who was taught to use my hands and my head and my heart. When you're practicing as a doctor, you mustn't forget that your patient is a person, not a case. I was the first CEO of Gleneagles. I wanted the hospital to have doctors that practice well, not practice for money. So I chose my doctors.
Medicine, rewind and play. In the past, medicine was a little different. In medicine, rewind and play, we sit down with the legends, doctors, nurses, and healers who shaped healthcare in their time and ask what they'd keep, what they'd change, and what we need to remember. Medicine, rewind and play.
Did you spend a significant amount of time in Malaysia?
In 1974, I came back from overseas, further my study in cardiology, so that I could set up the cardiac place in Singapore. But when I came back, they had decided to start a medical faculty in KL in 1973. That time, there was no building, nothing. So they appointed the dean, and the dean started the building. He needed teachers, so he took from Singapore a few of us. I was bonded to the government because of my overseas trip. So they had to ask Lee Kuan Yew, and Kuan Yew said, okay, let her go, but let her pay from there. When I earn a salary, I have to pay back Singapore. I graduated in 1953. That time, I started teaching officially as an associate professor in 1974. That was the first batch of students, and they said I was like a lioness. I said it's because I wanted the faculty to have a good standard, and we did. Before the first batch graduated, professors from England to come as external examiners, and they passed them and allowed them to register for the GMC without taking an exam. So our local degree was equivalent to the GMC. And this first batch was the one who had the graduation ceremony.
The 50th anniversary.
50th.
So you would have encountered a great number of healthcare workers over all these years. Do you think are the most important qualities in a doctor?
When you're practicing as a doctor, you mustn't forget that your patient is a person, not a case. So whenever we refer to a patient as a case, as a student, my teacher will say, not a case. The person has a name. So we cannot call the person a case. We always refer to the person as a person with a name. And that's how we as teachers pass on to our students. That's why they say I was very strict. I was.
But they remember you, and I don't think it's a bad way.
No, now they call me Mama Wong. They say, you have become like a mother with the cups. They send me a picture of lioness and her cups. They realized that what I was trying to teach them was for their good. During those days, we had no scans, nothing. So we had to, with our hands, try to diagnose. We can be wrong. Now, of course, the technology is good. Nowadays, they allow the technology to overrule the art. Medicine is like a coin. One side is the art, but the other side is the technology. But nowadays, the technology has taken over the art. I was asked, when you go for surgery, would you like a robot to operate on you? I said no, because if anything happens, the robot is not trained to think. The robot will do what it is trained for. I said, I don't want a robot.
What do you think is the role of technology and tests?
As in our time, we should listen to the patient, come to a differential diagnosis, maybe 1, 2, or 3, and then allow the test to help us to decide whether it's 1, 2, or 3. Even nowadays, the cost of medicine has gone up so much because of all the unnecessary tests that have been done. In those days, we were very strict about that. Actually, these students of mine, they wrote a funny story. They said this lady brought her duck to the vet. The vet said, "Your duck is dead." So she said, "How do you know my duck is dead when you don't do any tests?" So he said, "All right." So he brought his Labrador, and the Labrador went round, and the Labrador shook his head and went up. The duck is dead. Then he brought in a cat, and the cat sniffed at the duck and also shook his and went out. She asked for the bill. Then he gave her a $3,000 bill. She said, "Wow, 3,000 to tell me my duck is dead." He said, "If you had listened to me, I will only charge you 100. But because of a lab test and because of a CAT scan, I charge you 3,000.